Neurological complications after cardiac surgery. So there are many complications which can happen after cardiac surgery, and a stroke is one of them. Stroke is sudden onset of neurological deficit from the death of brain tissue, and it is one of the most common cause of death after cardiac surgery. So it leads to a lot of morbidity as well. Risk factors include the same as that for heart attack, which include hypertension, diabetes, hyperlipidemia, and tobacco smoking. So it happens due to sudden blockage of blood flow from the brain, and it is caused by bleeding in the brain as well. The cerebral vessels are blocked either by thrombosis or by embolus to the vessel. The emboli usually originate from the heart after atrial fibrillation, in valvular heart disease, or in DVT. If there is paradoxically, they can emboli to brain in the presence of a PFO, and they can happen in carotid stenosis as well. So as we know that we have anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. The anterior cerebral artery strokes can give rise to cognitive defects, confusion, and personality changes, and there can be leg weakness, which is more than arm weakness, and can have urinary incontinence. The middle cerebral artery stroke, which is one of the commonest causes of stroke, leads to weakness or sensory loss or apposition on the opposite side, and can lead to hemianopia as well. And they can also cause aphasia. The PCA strokes give rise to ataxia, contralateral sensory loss, and ipsilateral sensory loss. So the diagnostic workup is by CT scan mainly, and the treatment is depending on the site of the cause of the stroke, that is ischemic or embolic, and we treat them accordingly to the cause. Evaluation include echocardiogram, ECG, Holter monitoring, and carotid duplex analysis. And we need to control the risk factor for the stroke, which include diabetes, hypertension, and control of cholesterol and tobacco smoking. Another cause condition is subarachnoid hemorrhage, which is not that common after cardiac surgery, but can happen. So they present with sudden onset of headache, and the aneurysm usually lies in anterior portion of circle of Willis, and they present in 2% of the routine autopsies. So not that common. They can be associated with polycystic kidney disease, high alcohol consumption, hyperlipidemia, hypertension, and tobacco smoking. The patient usually present with sudden onset of severe headache, which they say as the worst headache of the life, and stiff neck, photophobia, and fever. And there can be a loss of consciousness also. Again evaluated by CT scanning, and the treatment is nimodipine, which controls subsequent ischemic stroke, embolization, and we need to give seizure prophylaxis as well. Post-cardiac patient can also present with headache, and could be of any degree from mild, moderate to severe. Commonly the patient who are suffering with migraine, they have recurrent attacks after surgery, and There are various aggravating factors, and patients know what causes aggravation, especially dehydration. So we need to avoid those precipitating factors. Other causes are cluster headaches, giant cell arthritis. So the treatment include various analgesics, and migraines are treated by triptans, and cluster headaches are treated by ergotamine. And as we use beta blockers, they also act as prophylaxis for migraine. And there are various neuropathic pains, trigeminal neuralgia, postherpetic neuralgia. So they should be diagnosed with history, and trigeminal neuralgia is treated with oxycarbazepine or carbamazepine, and postherpetic neuralgia is treated with antiherpetic medications, and we can add gabapentin and pregabalin for that. Spinal problems can be seen after cardiac surgery, and there are various spinal issues that needs to be considered. So there can be infarction to the spinal arteries, especially anterior spinal artery infarction if present. They're present with loss of all functions except for the posterior column, flaccid paralysis, and loss of deep tendon reflex evolves into spastic paralysis and loss of pain and temperature sensation, and there is extensive plantar response. And if there is spinal trauma in the patient preoperatively, then they can present with pain and bladder dysfunction, and if needed, they need to be treated with glucocorticoids. Syringomyelia, if the patient has syringomyelia, again they will present as a sensory loss and cape-like distribution of sensory loss, and they should be treated accordingly. Multiple sclerosis is a relapsing and remitting disorder, so the patient will give you the history of having multiple sclerosis, and they can be treated accordingly. They can present with focal sensory symptoms, with visual problems or balance problem. Can have fatigue, spasticity, hyperreflexia, or cerebellar defects. Diagnosed with MRI, which can be done, and can also be diagnosed with oligoclonal bands in CSF. They are usually treated with beta interferon. Amyotrophic lateral sclerosis is one of the common motor neuron disease, and gives a challenge in post-operative cardiac surgical management, as there is weakness with usually in the upper and lower limbs, and they present with difficulty in chewing and swallowing, and there is a decreased gag reflex. So patient needs to be NG fed and need to have salt evaluation, and there are higher chances of aspiration, and there is a weak cough, and swallowing is poor. CPK levels are elevated, and riluzole is the treatment of choice. Can also be faced with peripheral neuropathies of various sorts, and most important is neuropathy in diabetes mellitus. They are treated with pregabalin and gabapentin, and tricyclic antidepressants can also be used. Myasthenia gravis is a disorder of the muscular weakness from production of antibodies against acetylcholine receptors at the neuromuscular junction, and they present with the weakness of the limbs worse at the end of the day. And diagnostic test is hydrophonium, and they can be tested with electromyography and treated with neostigmine and pyridostigmine. Thank you.